Hello, this is Dr. Grande. Today's question is, what is dependent personality disorder? So, dependent personality disorder is a cluster C personality disorder in the Diagnostic and Statistical Manual, the DSM. So it's in the same cluster as avoidant personality disorder and obsessive-compulsive personality disorder. Cluster C is considered the anxious, fearful cluster. So when we look at the symptom criteria for dependent personality disorder, we see a number of potential symptoms, including having difficulty making everyday decisions without excessive advice and reassurance from others, needing others to assume responsibilities for most areas of one's life, difficulty expressing disagreement, and this difficulty is because there's a fear of loss of support, difficulty initiating projects, and this is because of a lack of self-confidence and not a lack of ability or motivation. Going to excessive lengths to obtain support, feeling helpless when one is alone, seeking relationships for support right after another supportive relationship ends, so moving quickly from one relationship to another, and a preoccupation with fears of being left to take care of oneself. So we can see there's a theme here with dependent personality disorder, that somebody is concerned about being abandoned and having to take care of themselves and has trouble making decisions. So we see a number of other characteristics and associated features with dependent personality disorder. For example, being submissive, passive, having a low amount of anger, even in situations where some anger would be justified, tolerating abuse, having a pessimistic attitude, and appearing clingy to other people. Now, there's been some research done on how individuals with dependent personality disorder often present in therapy, and the findings there show that they're often compliant, conscientious, and eager to please. So there's this perception sometimes in the mental health community that individuals with dependent personality disorder are cooperative clients. Now, dependent personality disorder is comorbid oftentimes with other personality disorders, mostly borderline, avoidant, and histrionic personality disorders. As compared to the other personality disorders in the DSM, dependent personality disorder is often thought of as having low to moderate impairment, although certainly this is not always the case, but that's a popular perception of this personality disorder. So as I mentioned, there's personality disorders that sometimes are comorbid with dependent personality disorder, but there's also other mental health disorders and physical disorders that are oftentimes comorbid with dependent personality disorder. And sometimes dependent personality disorder appears to be a risk factor for those physical and mental health disorders, and other times it appears to be a consequence of physical and mental health disorders. So its relationship with physical and mental health disorders that are comorbid is a little bit complicated. Now, because of this perception that dependent personality disorder is often associated with low or moderate impairment and a decreased anger response, oftentimes we think of dependent personality disorder as not associated with any type of violence. But actually there are some associations. Individuals with dependent personality disorder, in particular men, are more at risk to be perpetrators of domestic violence. And men and women with dependent personality disorder are at a greater risk to be perpetrators of child abuse. And they're also at a greater risk to commit self-harm. So even though dependent personality disorder has this perception that there's not much violence associated with it, it can still be a disorder that has a dangerous component to it. And appropriate care must be used in treating dependent personality disorder. I hope you found this description of dependent personality disorder to be interesting. Thanks for watching.